Hi, Mr. Jones. My name is Austin Jones. I'm a student physical therapist at the University of St. Augustine. So based on your diagnosis of that frozen shoulder on your right arm, I have a treatment in mind today that I think would be beneficial for you called ultrasound. But before I get kind of into the details on that, I do have to do a couple tests just to make sure you are an appropriate candidate for the treatment. So before we get started, I'm just going to do a skin integrity test as well as a sensation test just to make sure you have the feeling in that area that I want to treat. So are you comfortable with removing your shirt for me to do those tests?
Yeah.
Okay, so you can go ahead and remove your shirt here, and I'm just going to look at that right arm. Okay, so first I'm just going to look for any open wounds, burns, any rashes in the area that I'm going to be treating, which everything looks good. And then next I'm just going to check your sensation, so just let me know. I'm just going to give you a little bit of a light touch on your skin. Just let me know if you feel it or if you do not feel it, okay? You feel this?
Yes.
You feel this?
Yes.
You feel this?
Yes.
You feel this?
No.
You feel this?
No.
Okay. So based on those two tests, you are an appropriate candidate for the treatment. So the treatment's going to be called thermal ultrasound, and what this is going to do is it's going to warm up the tissues in that right shoulder area in order to kind of increase your range of motion, your functional mobility overall. So we can go ahead and sit up on the edge of the table, and then I will help you get into the proper position. So we can go ahead and stand up and sit on the table here. And then I'll just help you kind of into that proper position. So just lay down on this bed. Good. All right. And then I'm just going to grab a couple of things here to make you a little bit more comfortable. So I'm just going to put this under your legs here just to make it a little bit more comfortable on those knees. Good, and you can relax. And then this pillow is just going to go under your left arm. And would you like a drape for the treatment? Okay. All right. And then this is just going to go under this right arm and put it in a better position. We can just rest here while I get everything set up on the machine here. So first I'm just going to check for the BNR and the ERA of the machine. So the max BNR is 6.0 and the ERA is 2 centimeters squared, which means I have a treatment area of approximately 4 centimeters. And my power or my intensity is only going to be 1.3, and so I do not exceed that 8. And before I turn on the machine, I'm just going to mark the area that I'm going to be treating today, just to make sure we're in the right area. Okay. So that area I just drew on your skin is the area we're going to be focusing on, okay? All right, so I'm just going to go ahead and set the machine up here. So we're going to be doing since it's thermal ultrasound, we're going to be doing a continuous duty cycle. We're going to be doing this treatment for about 3 to 5 minutes. And we're going to do a 3 megahertz frequency because we are focusing on that superficial target tissue. 3 megahertz. So we'll go for 5 minutes. And I'm going to go ahead and apply some of this gel here to that area. I'm just gonna have you rest your arm right here on my shoulder here, or on my side. And we're gonna go up to 1.3, and all of our other parameters are all set here. And then I'm gonna go ahead and spread this gel out a little bit. So you should feel some warmth with this treatment, potentially. You may not feel any warmth, but it is kind of warming those tissues just at a molecular level. So if you have any kind of pain or anything other than that, just let me know, okay? All right. Feeling okay?
Mm-hmm.
Still doing all right? All right, so we're gonna go ahead and stop the treatment here. We can just relax that hand there, perfect. Go ahead and shut off the machine, and then I'll get that ultrasound gel cleaned off of you here. And then before we get up, I'm just gonna check your skin again, just to make sure there wasn't any adverse reaction to the treatment, and make sure that sensation is still intact, okay? Okay, so skin is still normal, no adverse reaction to the ultrasound treatment, no open wounds or anything like that, and no rash, so no abnormalities there. And do you feel that?
Mm-hmm.
You feel that?
Mm-hmm.
You feel that there?
Mm-hmm.
Okay, so sensation is normal. So that concludes our treatment. I'm just gonna help you get back up into sitting and then off the table, okay?
Okay.
All right, so I'll get this out of the way. That as well. Okay, so we can just swing our legs over off the right side of the table here, and then I'll help you. So 1, 2, 3, good. Feeling all right?
Mm-hmm.
All right. And that concludes our treatment.